Well, more than 20 million Americans are now using GLP-1 medications like Ozempic to lose weight. And while the health benefits are real, many are starting to notice some unexpected changes when they look in the mirror. It's called Ozempic face, and a Metro Detroit expert is here to explain what's happening, why it happens, and what you can do about it. Joining us now is Dr. Charles Boyd, Harvard-trained facial plastic surgeon and founder of our sponsor, Boyd Beauty. Dr. Boyd, thank you for being with us on Live in the D.
Great to be here.
Welcome. All right, so let's get into this because it's something we see on social media. It's all over the place. Ozempic face. We talked about it in our introduction. What are people actually noticing with Ozempic face?
Yeah, it's a great question. So, a lot of us are on these medications to lose weight, but you don't know the impact it's going to have on your face. And so I always say you want a thin body, but not a thin face. So when you lose particularly a lot of weight rapidly, then you can look more aged. And so the skin changes, the face changes, more sagging, more drooping. And so that's really what Ozempic face is.
So it's how rapidly you're losing the weight.
Yeah, it's rapidity, and it's also the places that you lose weight. And so it makes, particularly under the eyes, the temple, the sides of the face. And so a good analogy I like to use is if you took a balloon and you let half of the air out, you'd have laxity in that tissue.
Interesting. So why does weight loss from these medications really affect the face so much?
Yeah, it's interesting. The more we know about them, we also know that the fat underneath the skin has different hormones and different things called secretomes that actually help your skin look more vibrant. And so when you lose those, you can also make your skin drier, more wrinkles, more lines.
So what's actually happening structurally in the face when people lose weight this quickly?
Yeah, I think the structural things that you see is dark circles, hollowness, neck laxity. And so all of those things can make you look older rather than younger.
So is this something new, or is it just happening faster than normal aging?
Yeah, it's normal aging. I think you're seeing it just sped up. So I think we all lose volume in our face over time, but this is really a rapid change that people are seeing, and they're really not expecting it. And so that's the thing that's surprising.
It can be a little jarring.
It is.
Right, when you're trying to just get healthy and do the right thing.
Yeah.
So if someone does start to notice these changes, what can be done to restore a natural look?
Well, that's the beauty of it. So now we know that you can, at the same time that you're losing weight or even before, do some things to help prevent that loss in your facial tissue and structure.
Okay. So should people wait until they finish losing weight before addressing this, or?
I would say do it before. I would say that if you can go to a place that's familiar with it, I like to talk to my patients about their weight loss journey, and if you're considering it, we can start a program so that you never lose the weight in your face, so you always look younger and healthy and more vibrant.
So what are some of those things that we can do?
That's a secret. No, that's not. Yeah, so come see us.
Okay.
But we actually just did a study that showed there are some injectables and some biostimulators, a lot of products that now build collagen, build elastin, and so those are the structures that we naturally lose as we get older. And so if you can replace those now, we can prevent those losses.
Okay, so you probably work with people on a very individual basis.
Yes.
Let's figure out what might work for you.
100%. It's all individualized. It's not, there's no one size fit all or cookie cutter approach. And so that's really why you talk to a professional that knows kind of what they're doing, what you want, what your needs are.
And be proactive is what you're saying.
Be proactive always.
Don't wait. All right. Well, Dr. Boyd, thank you so much for being here.
Great to be
This is
here,
great
Tati.
information.